Reason for that is that we were concerned, the public health community, and many people were saying this, were concerned that it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, who were brave enough to put themselves in harm's way to take care of people who were infected with the coronavirus and the danger of them getting infected, we did not want them to be without the equipment that they needed. So there was not enthusiasm about going out and everybody buying a mask or getting a mask. We were afraid that that would deter away from the people who really needed it. Now we have masks. We know that you don't need an N95 if you're a ordinary person in the street. We also know that simple cloth coverings that many people have can work as well as a mask in many cases.
Well, with the scare of the coronavirus, many people have been running to the store to buy face masks similar to this one to protect themselves. Now, this mask protects against airborne hazards, and those stores have been running out or even running low on these. But health officials say they don't know if these masks will actually help you. The CDC recommends only people with the coronavirus symptoms wear a mask, not the healthy people trying to prevent themselves from getting sick.
General mask wearing probably won't help because what's needed is the sophisticated N95 mask, the one in short supply for frontline medical staff.
The N95 mask has adequate filtration for viruses. If you wear a surgical mask, that doesn't provide adequate protection.
But when we get in a situation where we have enough masks, I believe there will be some very serious consideration about more broadening this recommendation of using masks. We're not there yet, but I think we're close to coming to some determination.
The Chicago Medical Society is worried that a call for general mask wearing will reduce social distancing, and soon will be like Spain, where healthcare workers make up an out of proportion 14% of COVID cases. Surgical masks are not that effective either.
If you sneeze, that prevents the droplets from going out at a very small angle, doesn't prevent it from going out the side of your mask.
But the head of the Chinese CDC says America may be making a mistake by not mandating mask usage. And an American researcher says 38 scientific papers back that up.
My concern is that people will feel a false sense of security using a type of mask that may not protect others from their illness.
We also know that simple cloth coverings that many people have can work as well as a mask in many cases.